I think there's a big difference between the clinical support you need and the support that you're getting on the outside. The clinical support, I had to trust. I trusted 100% my GP. My GP was amazing. So he was male. He was very, very honest with me and said that he had very little knowledge on menopause, and he decided to actually refer me to an endocrinologist. There was a 4-month wait, and that was short.
The response from the medical profession and my local doctors was awful. And I actually don't think a lot of those doctors knew all the symptoms. Social media has been my friend in terms of these different little posters that go through all the different varying symptoms.
My doctor really never mentioned menopause to me. It was all about, oh, we have to manage your diabetes, Stacey. You know, you need to eat right, you need to exercise, you need to do that. But nothing was ever touched on about menopause.
It was really through Instagram, which is a bit sad, but Instagram and starting to scroll. And I saw this thing on Instagram with this whole list of symptoms, and one was anxiety, and I was like, I think this is what it is. Yeah, so I joined the dots myself and I started to learn about perimenopause.
But nothing was ever mentioned about why don't we maybe look into getting you into HRT, or even to have the discussion. That was never raised by my GP. It only arose when I said, I cannot live like this anymore. What else is there out there for me? And it was me where to initiate to say, how about HRT?
HRT, the hormone replacement therapy, as an option. No one's ever spoken to me about that.
Look, I feel like I was very fortunate. I had a male doctor who very early in my journey started taking blood tests and doing extensive blood tests. So I got a real sense that he was on my side and supporting me to get the help I need. It took me probably 12 or 18 months to make the decision to go and obtain Western medicine, so HRT. When I had the appointment with the endocrinologist, at the end of it, it was a telehealth, and she gave me that look, that I feel for you look, and I burst out crying. She said, have you got any questions for me? And I'm like, when will this start working? And she looked at me and she chuckled and she said, it'll start working in about 2 weeks. And I just went, oh my God. At day 10, I woke up in the morning. I was so excited for life. I look at what I'm doing now and the impact of taking HRT and the amount of work I'm doing and the physical work that's demanded of me, and go, I wonder if I could work at this capacity if I wasn't on HRT. I do have a work colleague that came to me, and she went and to her GP, who she trusted for a number of years, and her experience with her GP was a lot different to mine. She felt like they just fobbed her off, and when she got the results back and it said that potentially she is, they didn't give her any further information to help her.
I fought to get referred to an endocrinologist. I just went there and I said, there's nothing wrong today. I just want a referral to an endocrinologist. And I just said it as in a matter of fact, I'm not leaving until that referral is done. I spent an hour with that doctor. I came out there feeling very happy. Even my step was different. When I got back to the office, people were like, wow, Stacey, you look happy. I said, for the first time, I've had a doctor who's listened to me, and we've made a plan.
Is there a menopause expert? Is there a menopause clinic that you could go to and then have, ongoing kind of consultations, support you through that journey? Unfortunately, it didn't surprise me that there was no information out there, and the women's health is not spoken about. It's not, information's not widely and easily available.
It's a journey. You have to be relentless in finding the strategies that are right for you to be able to manage it. Don't stop inquiring about it if you've got a niggle. Be relentless and persistent, because it's about your own mental health and wellbeing.